Great. Well, let's get started. I know all of you are very busy, and I certainly appreciate the time being here today and taking the time to join me today and contribute to this important discussion. You're all well aware, human trafficking is the fastest growing industries in the world. Traffickers using violence, debt, bondage, and other manipulative tactics to force people into modern day slavery. Perhaps one of the greatest myths about human trafficking is that in other countries, but not ours. That couldn't be farther from the truth. We've had human trafficking cases reported in all 50 states. Ohio is ranked as high as 5th amongst all states reported in human trafficking. Thankfully, we've dedicated professionals such as yourselves on the front lines working to eradicate the terrible crimes, support survivors, and bring human traffickers to justice. And one thing about this pandemic, it's caused us to use Zoom more and more. I'd much rather be in contact personally with all of you, but when we're trying to get back and devise some method for getting post-COVID or COVID relief, post-COVID relief, it's important to hear from all of you, because I'm looking forward to hearing what your organizations have accomplished here in the fight against human trafficking in Northeast Ohio, the success efforts that and the efforts you've had, the challenges you faced, and how I can continue to support you at the federal level. So with that, glad to, I don't know if we had a meeting, but glad to let anybody feeling up to it at the moment start off. Why don't you just give a organization and some of the things we've got going on. Or you want to call on?
I'll go first if you're ready for me.
Let's go.
Okay. I'm Sondra Miller. I'm president and CEO of Cleveland Rape Crisis Center. Nice to see some familiar faces on the call. Thank you for hosting us today. I appreciate the time, energy, and attention that your office is putting into anti-human trafficking efforts. Cleveland Rape Crisis Center has been providing support services to survivors of human trafficking since our organization started in the 1970s. We have not always had the label of human trafficking to put on some of the stories and experiences that we have heard here. It's only come about maybe in the last decade or so, but a number of years ago, we started a specialized hotline, 24-hour hotline, specifically for survivors of human sex trafficking, as well as professionals who support them. And we have, any given year, we have 200, 250, sometimes as high as 300 phone calls a year that we receive on that line. Most of the calls are from professionals, a couple of them who are included here in the call today, who contact us if they have a survivor who's in need of support services. We tend to be a bit of a central intake, coordinated intake for survivors who may need housing, may need addiction recovery services, may need access to food. We also, as a rape crisis center, provide victim advocacy for survivors who are engaged with the criminal justice process and trauma counseling, as well as other case management services. We have seen since COVID hit in the spring, a tiny bit of a slowdown in the number of calls that we're getting. We don't have a sense that that's because human trafficking incidences are going down. We think it's probably even harder now than previously for survivors to reach out for help. We just very recently got our hotline can also be accessed through text. So very recently we're texting with a survivor who said her abuser was not allowing her to leave the house. She couldn't make a phone call because he was always there. She was texting with us, with our support line, while her abuser and her trafficker was sleeping right next to her. She was very concerned about safety and very asked us a lot of questions about whether we were the police or whether we would contact police. And we had to provide a lot of assurances that we are an independent organization. We're there to support and empower her and help her make good choices. And should she wish to engage with law enforcement, we would certainly help her do that, but it was not a requirement of seeking support. The most positive thing that I have to share is we are planning to open a new drop-in center for survivors of human trafficking in the first quarter of 2021. We have chosen a site in the Glenville neighborhood of the city of Cleveland, and construction is well underway. We're thrilled to be awarded a grant from the U.S. Department of Justice Office on Victims of Crime to initiate that project. And we are actively fundraising locally to bring in all the funds we need to bring it all the way to opening day. So that's a little bit about what we're working on, some of our challenges, and one of the things we're really proud of right now.
That's great, Sondra. Thank you. I'm just going to, because it's a little confusing, obviously, having everybody on here, so I can't see next in line because it might be different for all of you. So I'll go next to what I've got here. Kalyn, why don't you give us a, if you could, your group is certainly the one that educated me as to the problems that are in the Hotel and Lodging Association. So how are things?
Thank you, sir. Kalyn Stevens, again, Vice President of Government Affairs at American Hotel and Lodging Association. Thank you for having us and for pulling together a critical dialogue and talking about the hotel industry's efforts. We're really pleased to be here. You know, it's been a longstanding commitment of the industry. And we really, last year, we launched our No Room for Trafficking campaign, which we've actually seen a lot of success behind, and raising awareness with the industry and really rallying the industry behind a single comprehensive approach, really with the goal of training every single hotel employee. We provided a plan of action for everyone, which of course included the training, included the human trafficking indicator signage, coordination with law enforcement, which so glad to see so many here today, and of course, you know, building on best practices and the work we've done with prevention partners. You know, the human traffickers often rely on legitimate businesses, many in the tourism supply chain, right, to facilitate their illegal businesses. And so we know that the hotel industry is in a critical position to help stop and spot human trafficking. I think given COVID-19, we've seen even more of a reason why training every single hotel employee is even more critical than ever before. Our latest survey, 9 out of 10 hotels have had to lay off or furlough employees. So no longer is someone designated to do position X or Y, they're now wearing multiple hats, right? And they're serving as front desk, housekeeping, maintenance, F&B, you know, you name it, and they're working whatever is necessary to keep the hotel industry and their particular hotel afloat. So it's even more critical than ever that every single hotel employee be trained. We've continued during this time to work with our nationally recognized prevention partners. We were really pleased. It was actually like right at the time that COVID was hitting in March that we were rolling out a free training that was developed by Marriott and ECPAT USA and Polaris, and pushing it out through ECPAT's learning management system now, so that it's free training for everyone within the hotel industry. We're pushing it out to our members to ensure they know that they have access as well. We're also trying to think through, you know, new and innovative tools with our partners to think through. So we're obviously having enhanced cleaning and health and safety measures, right? We want to bring people back to our hotels. We want to make our guests and our employees feel safe. But how does this affect things like human trafficking and security concerns? So we're working on some best practices to make sure that we're coordinating with our partners and providing our members with key points and best practices that they can make sure that they're prepared, and especially in this new post-COVID era that we're working on. You know, I'll just say, we know it's an evolving situation with COVID-19. We also know the fight to end human trafficking doesn't have an ending point. Our industry is very committed to it. When we launched, you know, in 19, we held these in-person events across the country where we had government officials and law enforcement and prevention partners doing training. And obviously a lot of that's had to come to a halt, but we're now looking at, okay, you know, how do we hold these virtually? How can we make an impact even from a virtual perspective to get our members engaged, but also continue the critical coordination with government officials and law enforcement and partners and all of that. So we're planning to roll out some of these starting in January, which of course is National Slavery and Human Trafficking Awareness Month, but thinking through, several of these throughout the course of the year. And then when the in-person element comes back, the hotel industry will be glad to have it, and we'll be there to support and to obviously host these in person. But thank you again. This is definitely an area that it is critical for the industry, and we look forward to continuing the fight.
Well, thank you. It's similar, I think, to the opioid industry, where it's an all hands on deck approach that we have to take to fight the scourge.
Exactly.
And you're representing the Greater Cleveland Collaborative to End Human Trafficking today. Love to hear a little bit about you.
Thank you. I'm delighted to be with you, and I see some of my key partners on the call with me, so that's good to know. The collaborative has been doing this work since 2007, and we started out really realizing that if people didn't know about this, they couldn't do anything. So our first efforts were around education and continue to be education of various sectors. Whichever audience needs a presentation, we'll do it, and we'll do it based on the particular needs of that audience, whether it's middle school kids or physicians. It's going to be different based on that need. So we've done 2,500 kinds of presentations over that time, and have reached maybe 110,000, but that's not enough. People still don't know that it's happening. We also connect services. And so at this point, we are working with over 60 businesses, organizations, agencies, law enforcement in the Greater Cleveland area. And we meet every couple of months, and just as a whole group, to work on the identified priorities that we have in place. And they have included public awareness. So in the Greater Cleveland area, you will see billboards around town that say human trafficking happens here too. And we get calls frequently, a couple times a week at least, because people saw the billboards. So we continue that effort, even though it's rather costly. It seems to be making a difference. We also have an effort that we've been doing with the local hotels through the Ohio Hotel and Lodging Association. And so we did a lot of work, have what the hotels indicated that they needed were some suggested best practices. So with them, we designed what we thought would be the best practices and made big posters for the hotels in the area so that they could have those in their workroom with those suggested best practices, along with a 30-minute presentation, because at that point, the idea was it's better to do these in person in a 30-minute time. So we have speakers trained, ready to go, and it came to a screeching halt with COVID, of course. So next week we have a meeting with our hospitality committee to see what we can do now, how we can perhaps restructure a bit, what is still needed, and how to move that forward. We've been working very closely with our law enforcement friends, and I see Jim on the call, so he's been one of the prime movers for that, to figure out what does law enforcement need? What are the best practices for law enforcement? He can probably speak better to this than I can, but essentially that committee decided, what we need are a common policy among our police officers and law enforcement agencies. And what the patrolmen need is information in their hands. And they didn't want it on a name tag because that'd go in the wash. What they wanted was what they've called a ticket box card. So if you've ever been pulled over by the police, they pull out their metal box, that's a ticket box. I had to learn that. But what we put on there are the suggested best practice, what the issue is, and then what are the suggested best practices. And for our law enforcement friends, their first suggested best practice is take this person to a hospital, preferably a hospital that has a SANE program with it. So those are identified. And we have some anecdotal information that already it's helped. One of the Parma Heights patrolmen had his ticket box card and made a stop, and he thought something was strange in this car. The passenger had a deer in the headlights look. And so he went back to his vehicle to check out the registration, of course, and pulled out that card and said, yeah, this must be, let's call for backup. So we did. And because of that, a person was identified and given some initial help that she would need. So that effort goes forward. We've gotten it to almost 80 police departments in the region. We're working on the Cleveland Police Department. It's bigger, it's a little more complex, but we're almost there, we hope, because we want to do a follow-up evaluation. Is this helpful? Is this not helpful? What else do you need from us? And one of the plans is to do a roll call video so that we can address officers at the time of roll call to just remind them that this is an issue, you may be seeing this. We've been working with healthcare since 2016, and we have the 4 health systems in Cleveland working together on common guidelines. Now, getting them to cooperate on anything is an effort because they always compete. However, on this, they've agreed. We want common standards across the healthcare systems. So whatever facility you show up in, you'll get similar treatment. And all of our health systems are working very diligently to try to get in place formal protocols and then educate their entire staff, which is a monumental effort. And they're all at different points in doing that, but it's really necessary, and they continue to work on it, even with this distraction of COVID getting in their way, because they have some other priorities as well, of course. And we're working with EMT and fire departments because we know they get in places that the law enforcement would not even get in initially, and could identify perhaps some potential victims or those who are at risk. So those working with the EMT and fire officials, that committee has come up with some suggested best practices, and those will be implemented really soon as we get the posters made for the vehicles. So there's still a whole lot more to do. There are other systems that we haven't been in. Personally, I would love to get into the school systems. We get into schools here and there, but it's usually because we know someone or the principal or a teacher. We need to get into the education systems because the administrators, the staff, faculty, the cafeteria workers, the bus drivers, as well as the students and the parents need this information. Most of them are there with the kids all day. They're going to see things and they need to know what to do and whom to call. So that's what we're about. We continue the education as best we can. Now it's mostly done virtually, but we're figuring that out too. But thank you. I'm delighted to be with you and with all my colleagues here who are passionate about the same issue.
Oh, thank you. That sounds like some great things that you've been doing there. Those best practices are important, and obviously it's already worked out well. Didn't even think about that for first responders too. When you think about it, a lot of times there's drugs involved in this as well, so they might be coming upon an overdose and see a situation. So
we're concerned about, we're concerned that victims be treated with respect and dignity and a realization of the trauma that they have experienced. As professionals, we don't need to traumatize them more. So right. How we interact is really, really important.
Well, next on the list, I don't know if he's on, is Michael Gettings. There we go. Let's see if I see user here, but I didn't for your name. But
sorry about that. Thank you very much. My name is Michael Gettings. I am the Chief of Police here at the GCRTA Transit Police in Cleveland. And I know that we have worked with Ann and her group over the years to help combat human trafficking. Many years ago, our organization decided to take a stand against human trafficking. And what we did was we educated all 2,000 of our bus operators and transit police officers on how to identify victims of human trafficking and what to do when you do that. So we have had a few cases over the years. We recently had a case in East Cleveland during the pandemic. And our officers do understand how to identify and what to do when they do identify. So it has been difficult during the pandemic because we have seen a decline in ridership, but we have seen an increase in homelessness on our system. So we have been, I have a detective who's specifically assigned to the homeless initiative here and also to human trafficking. So he has a dual role. I have my team here with me behind me. It's Detective Sergeant Ron Darden and Detective Alfredo Cuevas. And Detective Cuevas is my detective who handles the human trafficking cases for our department. And what we've seen during the pandemic mostly is, like I said, the increase in homelessness. And our priority here at the Transit Police Department is to come up with a compassionate, non-criminal process to help those individuals. As Ann mentioned, you know, when you see a person in need, it's not a crime. You know, I think it's a societal problem. So we realize that, we've identified that, and it did become a problem for us because we had that great influx during COVID. Because quite frankly, you know, we do have a lot of resources in Cleveland for the homeless in Cleveland, but unfortunately during COVID, a lot of those facilities in many of the areas that they tend to use were shut down. And so we saw an influx on our system. It's like I said, as far as human trafficking goes, we did have a case recently where a female, we found a female who was being trafficked near one of our stations in East Cleveland. Our officers were able to identify that, contact Detective Cuevas, and they were able to take her to the hospital and get her the help that she needed. So I think that the important thing, as Ann mentioned, is that from a frontline employee perspective, that you have to have the training. As that Parma police officer had. If you don't recognize the signs, and if your employees aren't trained to recognize the signs, it is easy to miss. It is very easy to miss. So that is something that's been a priority for our organization, our department for many years. And we do take pride on making sure that our employees, not just their police officers, but our bus operators, because we have an operator on every vehicle. We do not have a police officer on every vehicle. So it is important for us to have the bus operators as well be educated on the signs of human trafficking. And if they do see something that concerns them, they will contact us and we will send an officer out to do an additional follow-up and investigation. I'd just like to thank you for including us in this process. And like I said, hopefully, what we found is partnership is the most important thing, whether it's partnership with the Northeast Ohio Coalition of Homeless, partnership with the ANS group. But from a law enforcement perspective, you can't do it alone. It's just overwhelming, and you have to have that partnership out there, and you have to be willing to reach out to those social service organizations to help you accomplish your goals. Thank you very much.
Thank you. I got to imagine with the homeless issue, the folks that you're confronting, not necessarily confronting, but running into, say, you're also running into mental health issues.
We do deal with a number of mental health issues. I would say that recently I was asked what our number one concern, my number one concern is for my officers. And the answer that I gave is mental health issues on our system, because it is extremely difficult for a police officer, regardless of who you are or where you're from, to de-escalate an individual who's experiencing mental health issues. We recognize that as a concern. And I've sent some of my command staff recently, and we're going to be putting together a new training program. I would say my officers, better than probably any officers in the state of Ohio, have a good understanding of how to deal with mental health, what to do when the person's in a mental health crisis. But that being said, it's still not easy. We want to come up with a peaceful solution, understanding that person is in distress. They're not committing crimes. They're in distress and they need help. And we've done a good job with that, but I still think there's room for improvement. And with a mental health situation, it's very unpredictable. So it's not like something I could just say, hey, this is a textbook. Here's this process. You need to follow this process. It's not that easy. I wish it was, but unfortunately it's not. And part of what we saw was in addition to the homeless increase on our system was, we had an increase in mental health on our system. We also work with frontline services here in Cleveland, though, to assist us with that. So Detective Cuevas does an excellent job partnering with not only the Northeast Ohio Coalition of Homeless, but also frontline services to really understand what the issues are, where the people are who are in need, and then we also have them coordinate with our officers and send these individuals out social workers out to assist with those individuals. We've had some great success stories, and unfortunately, some people don't want help. So we can't force them to get help. We have had some excellent success stories, particularly in the beginning. We saw a 400% increase in our interactions with homeless and mental health patients. And we were able to get those numbers down. They aren't yet at the pre-COVID levels, but they are manageable, I would say. So it was a concern that we had, something we dealt with, but I would say that our officers are well trained to handle that, and we continue to ensure that they have additional training.
That's great. Thank you. And Sophia.
Good morning, everyone. Thank you so much, Congressman, for having me on this call. I'm Sophia Papadimos, and I'm the Anti-Trafficking Coordinator at the Ohio Department of Public Safety's Office of Criminal Justice Services, and I manage Governor DeWine's Human Trafficking Task Force. It's good to see so many familiar faces, and I have to say, as someone who kind of looks at this issue from the state level, Cleveland has always stuck out as a leader in this field. You guys have been doing such great work for so many years. I mean, social services to law enforcement. So this is definitely a part of the state that other areas look to for guidance. And actually, Sister Ann, I was thinking of you. I know Maria reached out to you because we were on a national call a few weeks ago about integrating some of these trainings and protocols into healthcare systems at a larger scale than just one hospital. And so your organization came up just as someone who's really done that in the Cleveland space and within 4 hospitals, which is a huge task. So we are always happy to share those resources that you all have created. A little bit of background about our group. So back in 2012, the task force was created under the Kasich administration. Governor DeWine kept it on though. And when he was Attorney General, obviously this was a big issue for him then. But we've really had the privilege of working with so many state agencies to more comprehensively respond to this. So the task force was really created because at that point in time in 2012, a lot of state agencies may have had one-off initiatives, but there wasn't necessarily a cohesive effort at the state level to combat this. So that is where the task force was created and my role came into place. So we're a team of 3 in Columbus who work on this issue. Some of our, I think, biggest successes thus far, I should say, have been mandated training for a lot of state employees who sit in any type of inspection or investigative role, recognizing that you could be in a unique position to identify trafficking and to kind of repeat some of the things other folks have said. If you don't have that initial training to identify, that's the step 1, right? So many of you on the call are probably familiar with the egg farm case a few years ago in Marion, Ohio, but recognizing that our health workers and our agriculture inspectors really need to have those tools. So when you're going into an agriculture setting or when you're going into a workplace looking for what might be a health code violation or some type of livestock violation, that you're also in fact looking for a human rights violation. And what does that look like? And how can you assist by and we're not asking those people to intervene or play the role of law enforcement, really recognizing people need to stay in their respective lanes, but how can we train people to identify and then report? Also recently we worked with the University of Cincinnati to try and get a handle on how prevalent is human trafficking in Ohio. I think everyone in this call can attest to the challenges of collecting data. We have so many different data sets throughout the state. So our office put out a request for proposals, and University of Cincinnati was awarded to look at how prevalent is trafficking in Ohio with a specific focus on minors. So really what we gathered was, to be completely honest, our data isn't great, right? We have so many different systems reporting that don't actually all connect. So how can we, one of the takeaways is from that was, how can we better improve kind of our reporting systems, looking at law enforcement reports somewhere, child advocacy centers report somewhere. If you have a federal grant, you have to report to the feds, but not all of that, can be just put together as one because there could be duplicative cases. So it was really eye-opening experience to look at what we had. However, UC was able to look at over a 3-year period. We definitely had 1,032 identified individual cases of trafficking, specifically with a focus on minors. So that was based on the data that was available, which you look at was based on social service data, some law enforcement data, But going back to kind of, those are only people who had access to touch points within systems. That doesn't account for all the people who don't have access to services, who aren't identified, who haven't been able to report what's going on. So that was at least a starting point. So that is now a baseline that we can use in studies moving forward, and also just a recognition of where our systems can also be improved. I would say one of, with COVID, as many of you have mentioned, all of our trainings have had to go virtual. And so I think we're all kind of learning how do you engage people in a virtual setting, especially, we had 8-hour trainings that obviously you can't have someone sit in Zoom for 8 hours anymore. So just adapting to that. Also, a lot of our partners, we have a grant from Health and Human Services that's specifically focused on outreach. And so outreach was really put on hold for a while, especially in the beginning. People weren't necessarily going out in the streets conducting that because of COVID, concerns, rightfully so. But how can we navigate that? How can we now kind of pick up that outreach in a safe way, as well as programming within our prisons? So one of the other initiatives of our task force is that anyone entering a correctional facility, adults or juveniles, and then anyone entering a state-run mental health hospital is screened for human trafficking. So that if you are identified as a victim of trafficking, you are connected to services while you're incarcerated, recognizing that having a criminal record in itself it can be a vulnerability for trafficking. So a lot of that in-person programming that we've had in our prisons has had to halt because of COVID. So we've been working with the Department of Rehabilitation and Correction to figure out how we can take some of that programming virtually and what we can do in a safe space. So that's also been a challenge since COVID. But we're definitely looking forward to kind of working with folks to resolve some of these issues and continue our online platforms as necessary. And I would say our biggest initiative right now is we also just received funding from the Department of Justice Office for Victims of Crime to specifically look at improving outcomes for youth and child victims of trafficking. So we've partnered with the Department of Youth Services as well as the Ohio Supreme Court to look at how we can assist local courts who have human trafficking dockets to make sure that those kids who are identified have the case coordination necessary to help them with services. So thank you very much again for having me. I don't want to take up too much time, but I appreciate seeing you all and all the work everyone on the call is doing.
Thank you very much. I know that the Supreme Court, with our Chief Justice, a former prosecutor colleague of mine, that you'll have somebody who's more than willing to help.
Yes, they've been a great partner.
Samantha.
All right.
Samantha, how are you?
I'm doing okay. It was actually a kind of eventful morning, but overall it's good eventful, so I can't complain. So let me give you a little bit of background of the perspective that I'm coming from, and then we'll go forward and talking about what I'm representing. So I work at Asian Services in Action. I work with victims who are immigrant and refugee victims of human trafficking. Mm-hmm. So I come at it from a very different perspective from a lot of people, in the sense of, one, I'm an attorney myself, so I look at the immigration aspects of human trafficking and being a victim, but then also the various other legal issues. Furthermore, I am on the Ohio Attorney General's Human Trafficking Initiative. I work as the chair to the Legal and Legislative Subcommittee, and then I'm also on the Victim Services Subcommittee as well. So that all being said, that's kind of getting a background of where I'm coming from. So my role today is as the legislative chair of the Summit County Collaborative Against Human Trafficking. So we've been around since 2009, but I must say that it was only the past about 3 years where we have thoroughly flourished, and we've really been able to get things out there. The one thing, there's been an abundant amount of things that we have done over the past few years, including we have been trying to get into a lot of different sectors. I think this is kind of a consensus amongst everybody here. There's a lot of different sectors that you kind of have to reach out to and educate in order to genuinely be able to provide competent services for survivors. So we've been able to reach out to, I think we're almost at 30 different organizations that are involved in the collaborative right now throughout Summit County, which is excellent considering that it was only a few short years ago, we were at like maybe 10. So we're doing great, and we are very, very blessed to have the Summit County Juvenile Court with us as they have the Safe Harbor docket. And we have some phenomenal magistrates and judges over there who are implementing it, which is great support system we have. We've also been able, because we've been reaching out to a lot of other direct service providers, we've been able to increase a lot of our funding that we're able to provide for survivors in the sense of just trying to become self-sufficient in general. A huge issue with a lot of survivors is that there's like you were mentioning, the debt bondage, or the fact that, you know, they owe or they have no stability. So we're actually able to collaborate a little bit better to provide funds, direct funds for our survivors as well. Obviously, I think Ann, and I'm part of the Cuyahoga County, so Ann does a phenomenal job as well. But we also have been doing a lot of outreach as well. And we've noticed that there is genuinely a lack of understanding. And what's kind of been talked about a lot here, which I would like to point out, is we talk a lot about sex trafficking, but not a lot about labor trafficking. Sex trafficking tends to be a thing. Whenever you think of human trafficking, people always think of sex trafficking. But we have a significant problem in labor trafficking around here as well. And being able to identify that, and first off, understanding that is a huge barrier that we're finding. So we actually created a subcommittee specifically about labor trafficking issues, from both an immigration standpoint, because typically they target vulnerable populations, which the immigrant and refugee community in general is a huge vulnerable population at the present time. But also other legal barriers or ramifications that they also face in being labor trafficked. So this is something that we're really trying to get into. We're also really we created a new subcommittee as well for youth. We have one of the leaders of the direct service committee for the Summit County Collaborative is from Rahab. Her name's Kelly Carey, who is an absolute phenomenal human being. If you don't know her, you should. She's done significant work, and she is just, her name is going everywhere nowadays, which is great. We're very blessed to have her. So we've been trying to parse out into smaller subcommittees as well to target things that we're noticing that we're having issues with. We obviously have an education outreach subcommittee as well, which deals specifically with training people about, you know, human trafficking 101 presentations, but also, again, a little bit more niche areas as well that we're finding in a lot of the survivors that we're dealing with on a direct basis. We also, which is probably one of the biggest initiatives that we've done in the past about 2 years, is we've created our own hotline number as well. Our hotline is directly connected to the Akron PD. But that being said, since 2020, we've had about 49 tips that have come in, which have resulted in 28 investigations, which is wonderful. But that being said, considering the fact of the vulnerable populations and who might be the target of trafficking, we also have created a good rapport with the police and understanding that sometimes survivors don't want to go to the police, at least at that particular time. So we have been working directly, the individual who takes the calls, there's a few individuals, but the main woman who takes the calls, she's gone through trauma-informed training. She is phenomenal in working with not only the police department, but also various other agencies that might be able to be a better fit for the survivor at that time and refer them off, which is a great, great thing. We've had extreme success thus far. Now going into the COVID situation. COVID has really impacted us in terms of obviously our education and outreach. That obviously has had to terminate to a certain extent, but we're trying to do more on the virtual platform like everybody else in this world. That being said, though, it is quite difficult. It is quite difficult, especially when it's coming to issues that people don't really necessarily think are issues, such as labor trafficking, such as working with the youth. So, I mean, we're trying to do more generalized presentations on, again, human trafficking 101, what are some basic information to know? But that too has kind of been somewhat of a struggle. And access to technology in general. I know it sounds really basic, but a lot of the communities that are particularly within Summit County, we have a huge refugee and immigrant community here. And a lot of that community do not have access to the internet, do not have access to or understand Zoom. So we're really trying to educate the community on how to get access to that as well, because it is important so that they can report should they, or if they notice anything. And the biggest thing, which I do have to make sure I put my 2 cents in about this, is funding. The funding's been terrible. We've had a significant cut because of VOCA cuts. A lot of our agencies are having to lay off a lot of individuals, which is direct services to survivors. And we know a bunch of different agencies have been affected by this. And we're trying to, again, increase our donations, but everybody's struggling right now.
Yeah.
And so that tends to be a struggle. So I think that is about all the updates.
Well, thanks. You know, that, and Sophia, you had brought up before about the egg case. And excuse my ignorance, but is that when you're talking about labor trafficking? Is that the same thing where they're going in on health and human health
Yes.
violations?
Yes.
Folks who are forced to labor?
Yes. And Marion, it was a large-scale labor trafficking case in which individuals were forced to work on an egg farm, doing kind of a skew of things, but not really being paid, living in horrible conditions. So that was back in 2015. But I think to Samantha's point, labor trafficking isn't that discussed that often or as often, and it's a huge problem, but also it is very labor intensive, and I'm sure law enforcement can speak to that. So those investigations can take years. There was another indictment, I think, as of 7 months ago, and this case started in 2015. So
Wow.
Just looking at those resources and investigations, Cleveland's fortunate to have a task force. I believe Summit County got some more money towards a task force. But we don't have those in all parts of the state. So I think part of that is if there aren't the resources to investigate, not an excuse by any means, Samantha, in terms of labor trafficking, but that's one of our priorities for our office too, is how can we better identify those survivors of labor trafficking and connect them to services. So
Great. And last but not least, Sergeant Mackey, I understand from Cuyahoga County SO, is here to give their insights.
Hey, Congressman, how are you?
I'm well.
So,
It's good to see
oh, cool. So, I also have John Morgan on the line with us. He's one of the detectives that works on the trafficking task force with me. So, I am a Sheriff's Department employee with Cuyahoga County, but also the Assistant Director for the Northeast Ohio, or what was the Northeast Ohio. It's now the Cuyahoga Regional Human Trafficking Task Force. So, that task force is through the Attorney General's office, the Office of the Organized Crime Investigations Commission. We're renewed every 2 years. We just got renewed for another 2 years, which is good. But with either labor trafficking or sex trafficking, we find that a local response is needed. And when we go out and do trainings, my goal is to get at least one officer in each agency, kind of as that resource person. That go-to person for trafficking, because this task force will not exist forever. And with the local responses, we have, great with the national hotline. We'll get resources, numbers from them and say, hey, there's a victim that called in. But if they're pushing that to an area of the state that doesn't have the resources to investigate it, that call may go unheard. So it's really important, at least here in Northeast Ohio, that we push out. We are a resource that can come and help with an investigation, whether it is sex trafficking or labor trafficking. I don't want to say they're easy investigations, but when you drill down to it, they're pretty simple investigations. With that said, though, they are very labor intensive, and most of the labor intensive piece is those resources that officers are trying to find. When I first started this, I was spending hours at 2 o'clock in the morning trying to find housing for our victim. And with our partnership with our most people on this call, I make one phone call. I said, hey, we got a victim here, and I pass it off, and that lifts 3 hours, 4 hours off my plate. So not only from the law enforcement aspect of having that person that is able to take the time out of, most agencies, if you take Cleveland, for instance, we filled in to work for Cleveland, in one of the zones. Their radio is absolutely crazy. I mean, they're bouncing call to call to call, and those officers are trying to figure out how to resolve that situation pretty quickly so they can jump to the next call, and they don't have to come back to it. So police are a lot like electricity. They go the path of least resistance. So with that, you know, trainings will say, hey, take that extra 5 minutes, scratch the surface. What's really the root of this, the cause of the problem? It might be a noise complaint. You know, what's going on? That might be a pimp arguing with one of his girls or guys, saying, hey, you owe me, where's my $50? And that may have started the noise complaint. The officer may just say, hey, I got 10 calls stacked up. I got to jump to the next one, and let me just go to the next one real quick. But so during COVID, we've seen kind of a decrease in calls. We still are somewhat fairly consistent with the numbers from last year and the year prior, but we have seen just a little bit of drop off. We're starting to see those numbers go up again. And a lot of our referrals are from our community partners. So as our community partners reopen, have reopened and started interacting with the community again, those calls have started to pick up again. So, you know, our calls traditionally come in from medical community, referrals from local police agencies and other social service agencies. So while we have seen some challenges resulting from COVID, for instance, hospitals didn't want visitors in the hospital. And while we can go into the hospital, but they're one of our good partners in this area. So we wanted to try to accommodate that and meet virtually if the situation was appropriate. We've made arrangements, we've received a grant. So we're gonna try pushing out either iPads or some type of device where each hospital system has the ability, if we go down into a shutdown again, where we can meet virtually with that victim. You know, we have, I'm getting older. We have other officers that have health issues. So we want to keep our officers safe. You know, if we take somebody out, if we get one of our officers injured with the medical condition where they got to be out for 2 weeks, that's a big blow, especially for my task force. We're running lean and slim. So like most police agencies. So, but from the aspect of what we can do, it's, you know, drill down to that lowest person on the totem pole. The person that really can affect the most change is the patrolman. They're the ones that are able to identify a situation and then start ringing that bell and saying, hey, we have a problem here. And then having those resources where they can reach out and say, hey, I need help, because that might have been the patrolman's first time doing one of these cases. And you know, a patrolman that has to handle something from start to finish in some of these agencies, their eyes are like a deer in the headlights. They're like, oh my gosh, I got to finish this by myself. But you know, we're a resource for that officer. And in Northeast Ohio, we're very lucky because we do have a lot of resources. One of the resources we are lacking though is housing. So from your level, that would be a great thing. Housing is definitely one of those things that we can't have enough of. So, and John, I don't know if you wanted to jump in.
Yeah, sure. Thank you. Hello again, everyone. Can everybody hear me?
Yep.
Okay. The only thing I'd like to add to that, I mean, there's a lot that we could talk about here on our side, but I think the biggest deficiency that I think we overlook is, you know, our juveniles. You know, we have a lot of things going on for our adult victims here in Cuyahoga County and here in the state of Ohio. But one of the things that we lack is a lot of resources for our kids. You know, in this task force, we've recovered people ranging from age 12 to 66. And here as of recently, we've seen a large spike in juveniles and them being exploited in this. They've always been exploited, but here we see it's starting to grow a little bit. And we have to rely on the Department of Children and Family Services. You know, we have to say, hey, you know, we recover a juvenile, we take them to the hospital, we have to call Children's Services. But we find that, sometimes, there just is not enough places. I mean, we have the likes of Belfair JCB, and we have Grace Haven, and we have different places locally and throughout the state, but still we find a deficiency in where can we house juveniles, with the exception of sending them to juvenile detention. Everyone here can agree that, if you're a victim of human trafficking, you don't need to be locked up simply because there isn't a place for us to send you. And that's the alternative that we have. We send them to one of two places where they may have a bed or two that they may be holding, but those beds are usually full because you're talking about people from all over the state utilizing those same beds for juvenile victims, juvenile survivors. And so when those beds get filled up, the alternatives are to take them to juvenile, or juvenile detention, I should say, or in our case here in Cuyahoga, we take them to the J. Netner Hunter building, and they put them in the child care room. But the only problem with the child care room is that there's, the kids can get up and walk out, and when they walk out, they're not coming back. So, Jim and I have recovered several young ladies 4 or 5 times that walk away from that child care room, only because we don't have a placement for them, whether it's they're not good, to put in a foster care home because they are trafficking victims, and we don't have a lot of foster care parents who are trained in dealing with children who've been involved in sex trafficking or labor trafficking. Or there's always a concern that they may disrupt a good functional foster care home because they're coming in with things that are dysfunctional, and sometimes they go in and they end up recruiting people from that foster care home to go back out with them. So you can see there's a whole wide range of problems with children, and it's all because we do not have a lot of places for them to go. So I would like just to point out exactly what we just talked about, is that yes, we have some things, we are doing some things that are wonderful here in Cuyahoga County, but that I think is the biggest problem that we're having right now.
Thank you. That's a good point. And all of you have brought up some very good points. And I just wanted to throw something out here as a question to get some input from all of you and your expertise. But earlier this month, Bipartisan Task Force to End Sexual Violence had a virtual roundtable on human trafficking. And I was honored to invite our special agent in charge of the FBI Cleveland office, Eric Smith, to testify. And one of the issues Agent Smith and a number of the other panelists stressed was the role of social media and other online platforms recruiting children and vulnerable adults into human trafficking rings. The experts know that necessary social isolation measures continue, and individuals' contact with the outside world grows increasingly dependent on cyber connectivity. This problem is further exacerbated. Can you elaborate on your role in your organizations are seeing in social media play? I can see some heads nodding when it comes to human trafficking, and how you're working to limit the use of these platforms for this malignant activity. And have you found any specific barriers in doing so? Feel free. I see Sister Ann, I noticed her head was nodding. If you have, just throwing it out there for if anybody's got some input on it.
I don't know if I have very good input, but it's one of the issues that comes up when we do presentations, and parents and guardians are absolutely freaked by children's, not only just their access, but what they know about and what they're not at all afraid about in using any kind of social media. So it's been a real challenge to help parents and guardians know how to handle that, because once a kid has a smartphone, they can get just about anything. And in these days, when they're confined at home, probably less supervision because parents are overwhelmed, you don't know who's doing what online and who their friends are. So I've learned a couple of things that can be helpful, but it's not always feasible for parents and guardians to play those games with the kids and see who's doing what online and begin to know who their friends are online, and not allowing that phone in the bedroom overnight. And those sort of common sense things, but they're going to get pushback from any kid who has a smartphone. So it's a huge issue. And then all the conspiracy theories that are going on social media, it just really compounds the issue and makes it even more difficult, I think. Others may have better experience than I, but this comes up virtually every time we give a presentation. The question will come up, what about social media?
So I think the issue, the overarching issue when it comes to social media is the fact of technology is faster than us. And if there's one social media platform that's finally catching on to something, another one will start. So this is, I think, this is the barrier. Big picture, that's the barrier. And I think another big problem that we're having is trying to identify all the platforms to somewhat have some type of recognition that this might be a platform for recruitment and grooming purposes of survivors. So for example, one huge platform that I keep repeatedly seeing in the victims that I'm dealing with is WeChat, which is a very common international form of communication. It's an app. It's typically in Chinese or Asian denomination. Those are the individuals that typically utilize it. But that's where a lot of survivors are getting tossed back and forth between traffickers. And so these are a lot, like, again, the bigger picture is we can't control the fact that somebody's going to use another platform. But being able to identify, and I think this goes back to education and understanding, being able to identify what does the grooming process look like? Because you're going to have to groom before you actually do anything for the most part. What type of communication is somebody having with somebody else in terms of, let's say, if they owe them a lot of money or let them borrow a lot of money? Or, I mean, these are the signs. And again, the only way that we're even going to be able to attempt any of understanding this is particularly with our youth is parental control over these type of things. But that's telling people how to parent their children, which nobody really likes to hear. But in terms of adults, I mean, the fact is that we just need to learn how to identify the grooming process and what it looks like and be creative. I mean, because traffickers are extremely creative in the different platforms they use.
That's a great point, Samantha. Has anybody debriefed a victim to figure out how they might have got just that way, what it was that brought him into the system?
Well, I can talk about one particular survivor that I worked with. It was a debt bondage situation. She was from an Asian country, and father was in having health issues. She needed to pay the bill. She borrowed the money, came to America, filed for a frivolous asylum application in America. Didn't know she applied for asylum while she was here, and that's what she was doing. She was paying off that debt. And it was, again, this was all, and she was bouncing back and forth throughout the country. Legally, she was here legally. She didn't know she was here legally, but she knew she was here. She was. And she was just, every time something would happen to the particular location that she was located, this is a sex trafficking situation, she got on WeChat and she found another position and she went there. So yeah, I mean, it can be, I mean, again, and this goes back to the education piece of what does being a survivor of trafficking look like? Again, we always have these images in our head of, you know, they're tied up somewhere and they're in a back room. It doesn't look like that all the time. A lot of them travel freely. A lot of them, you know, go from place to place. We just had a raid that was occurring in Summit County, and the victims just traveled back to, they were actually from New York, and they just traveled back to New York when they were done for being here for a week. So, I mean, it's difficult. This is where, and I'm no law enforcement, so I know my place, but this is where I think a lot of the struggles come because they are very transient as well.
Anderson, the only thing I was going to add to that is recently at the national level, the National Center for Missing and Exploited Children put out a safety pledge focused on social media. They reported seeing 126% increase in social media this activity on social media due to COVID. So they worked with the administration to partner on putting out this safety pledge far and wide. I'm not sure how many participants they've had at this point. At the point that we signed up, I think there were over 500. I'm sure the number has grown since then. But happy to share that information with your office, and maybe something where you could get some more data and information from them, even if it's sort of at a national level of what they're seeing of the social media impact on our youth.
Well, some of this was brought up, but I want to just throw it out there for, everyone to chime in. Law enforcement might fit more in your wheelhouse, but what type of crime are you seeing that overlaps with human trafficking? Are there particular recruitment techniques or tactics or opportunities used by the ringleaders to lure other criminals into trafficking operations? And what is the gateway to the crime, so to speak? I mean, Samantha was talking about the debt bondage, but what's driving or attracting folks into this?
Congressman, I mean, there's many, each case has its own merits, as you know, but, a common theme is they're promising something that they'll never get. That nice car, that nice house, love, drugs, they're going to get drugs, but it's going to be in limited quantities where they're always desiring more. And then it turns into, hey, you're going to do this because I told you so. And there's always that fear of force, or they actually see the force either on themselves if they get beat up, or if there's somebody else in that stable of girls or guys that gets beat up as well. But and then jumping back to the technology standpoint, the gateway is the cell phone. Every kid has one for the most part. The dumbest smartphone is good enough. It gets online, it gets to those apps. The biggest challenge we see is encryption to get into those phones. And for some of these apps, there's companies that are operating outside of the United States that don't respond to legal process. Now, some of the companies that are outside that don't have to, they voluntarily cooperate because of the nature of the crime. There are some companies that specifically operate in the commercial sex advertisement industry, and they're fully on board with helping certain cases. And that's conversations that we have to have with those companies. But from the biggest aspect, it's, the encryption is, I see why it's important to keep our personal information safe, but at the same time, there's a tunnel of criminal activity that we're not able to tap into. When we have the reason to, seize a cell phone and get a search warrant, not just willy-nilly going out there, but actually going, we're going through the legal process. And technology, eventually we're always a few months behind. If there's, updates to certain programs, we're behind a few months, or it might be a few years. But those are some of the barriers that we run into.
And Congressman, if I can add to the gateway question,
Please.
We see 90+% of the survivors of human trafficking that walk through our doors have a history of sexual trauma prior to engaging in trafficking. So they experienced child sex abuse. Either the case was never reported, or it was reported and the child wasn't believed. It was unsubstantiated. It never really got resolved. Child did not get access to trauma counseling or healing support. And it leads to another trauma and another trauma and another trauma. And it's the entrance ramp onto the highway of human trafficking, if you will. So often there's misinformation online, I think, about who's most at risk for human trafficking. And there's a lot of fear of, children being abducted from shopping mall parking lots and so forth. And of course, those things happen, and they're horrifying and they're tragic. But those who are most at risk for human trafficking are those who do not have access to education. They may not have a family support system. We know that our youth who identify as lesbian, gay, bisexual, transgender, if their experiences are not affirmed and validated, if they do not have a home that welcomes them, they are out on the street, they are couch surfing, and again, that's another entrance ramp onto the highway of human trafficking.
I know we're exceeding our hour, and I know I don't want to take it too far over, but beyond social media, what else are traffickers relying on to carry out their crimes or recruit victims?
They're
Where else?
relying on survivors who are too scared to come forward, and on professionals and others who aren't willing to identify and intervene when something happens. This entire industry exists on the silence and the sort of shove it under the rug. We don't want to think about it. We don't want to hear about it sort of mentality that we have as a society.
And Congressman, also on the demand side, they're not going to be pushing that product if there wasn't the demand for it. And, all too often, when we get a buyer of commercial sex, a John, they say, it's two consenting adults, and that's the argument. But they don't see the bigger picture. Obviously, when they're there for their 10, 15, 20 minutes, they have a limited conversation, and it's usually geared towards one direction. So they're not getting a personal history of that individual. So, the demand side is definitely what spurs this industry. And then on the labor trafficking side as well. But, as consumers of products that might be involved with labor trafficking, whether it's from a service industry, such as a restaurant or a nail salon or massage parlor, because it's in a professional building, it gives the clout of being professional.
And to add to that, I think one more thing, especially when we talk about labor trafficking and foreign nationals, I mean, traffickers rely on a fear of law enforcement, a fear of deportation, a fear of immigration policies. Survivors of labor trafficking and sex trafficking who are foreign nationals don't necessarily know there are T visas available. And even that process in itself is extremely long and complicated. But they rely on survivors not knowing what's available to them, which is such a scary thing to think about. But I think that's also something that traffickers work in their favor.
I'm going to add one more point, if I may, Congressman.
Sure, please.
I think also that human trafficking is both. There is a state law about it, and there is a federal law. But the problem is that so many jurisdictions in Ohio do not prosecute for human trafficking. We have, or do not utilize the safe harbor docket in terms for working with juveniles. We have an implementation problem of the fact of, one, people being able to, prosecutors and even law enforcement, no offense, Jim, but we have a lot of issues when it comes to law enforcement, prosecutors, even judges and magistrates having a significant issue in being able to identify and then pushing forward with charges of that way, which is not really incentivizing anybody to not traffic. I mean, we get bogus charges of solicitation or something that is a misdemeanor. It's not, and it's not penalizing people for actually doing the crime. Which again, luckily we've seen a few jurisdictions that are now kind of pushing forward with charging human trafficking charges for traffickers, but there are multiple jurisdictions that won't even touch it. And, that's one of the things that we're trying to do with the Human Trafficking Initiative, is trying to really educate jurisdictions on how to prosecute these type of cases, because a lot of people don't. And if there's one other thing I really want to make sure I say. The victim services of the Human Trafficking Initiative under the Attorney General, we have created service standards for serving survivors of trafficking. And one thing that we're noticing is, we're putting in a lot of work from experts in this area. And I don't use that term lightly. People who have worked with survivors for years upon years, and this is their bread and butter. And we are creating this elaborate service standards, but it doesn't have any teeth behind it. Mm-hmm. And so we have a lot of agencies who say, yeah, you know, we help human trafficking survivors, but it doesn't have any ramification. They can apply for grants saying they did so and get funded to do so. But the fact is that one thing that I know, and I've been told by my collaborative to make sure I say, is that if there's some way that we can connect those service standards to grant funding, that would be ideal to make sure that all direct service providers, and this covers a huge spectrum. I don't know if you're familiar with those standards, but I can send them to you. But if we can somehow, and we're in the process of reviewing them and revising them right now, but there's some way that we can make a connection between direct service providers who are serving survivors of trafficking to grant funds, that would be ideal. This way that we're making sure anybody who is serving survivors are meeting basic standards, because that tends to be a struggle as well.
I know we are so short on time. Samantha, can I quickly chime in on that? Our office, so the Office of Criminal Justice Services, is a grant administering agency. So something we've actually been working on this summer are those service standards being implemented into VAWA and FIPSA grants, so Violence Against Women funding and Family Violence Prevention funding. So that is something, but those are just two funding streams. But that is definitely something that we also recognize, that it's great these standards exist, and nationally people are looking to adopt these standards. Like, once again, super proud of Ohio for being kind of on the front of this response. But how can we give teeth, as you say, to them? So I just wanted to put, since we're all here together, I did want to put that out there, that we're trying to get that in the process for our office to be a part of our grant process.
Well, that's one good thing to know, because while we can't do earmarks in the federal government, we can't put in specific language into appropriation bills. But then we got to get the bills passed and signed, which has been a problem since I've been there. But you know, it's worked in helping push money towards things like, you know, problems like this and trying to resolve them. So that's a great point. I'm glad you guys brought it up. And look, I know I'm spilling over into your time, and you're all very busy. And I want to thank you again for taking the time to be a part of this important discussion. I think we discussed some of the highlights, just how critical any and all efforts are to eliminate this crime are, and the efforts to support victims and to ensure that they receive the justice that they deserve. The work you all do to save lives and make our communities a safer place means a lot to me. And I'm thankful for your time here today. And if I can ever be of any assistance to any of you, Katie's up there on the top of the screen. Smile and wave, Katie. She's here all the time. And Amanda is somewhere on the screen, not on mine. And she runs our office, and she's my LD and runs the office in DC for us, and is a Hudson native, so she understands Northeastern Ohio very well as well. And so we look forward to working with all of you in whatever capacity we can. Again, this is great to hear, because now as we go back and try to shape whatever COVID relief or funding package for 2021, I'll be better suited to help fulfill some of your needs. So God bless you all for what you're doing, and thanks, and have a great day.